Today we're here with Dr. Troy Carlson, and he's here to share some things with you, and I know the Lord has put some things in his heart. And Dr. Carlson, I know the Lord has put some things on your heart, and along with being chairman and founder of the organization, really grateful to your role in the organization as a physician. And take some time, if you would, to share with the people that are watching the things you would want them to know, or even probably we'll have some doctors watching this clip because of the fact that you're a physician.
Thank you, Gail. Love to share those things. Spiritual care for me kind of was born out of my experience as a physician here in our community. About 3 years ago, after being in practice for about 10 years, I began to see with the patients that were struggling with a lot of emotional issues, or what we would call or phrase in healthcare, mental health care issues, some frustration as a practicing physician. My traditional medical experience would share with me that when a patient is not being successful with regard to their treatment, whether it be their medication or their counseling, that a lot of times we needed to change that medication to a different type of what we would call neurotransmitter, which is a chemical in the brain, because there was something quote-unquote off. And so as a physician who was trained in modern medicine, I would make those changes. We would look at counseling. If it wasn't in place with just medication, we would add counseling. And so through the years of doing that, I would recognize that patients would initially get better, that counseling would be of help, but the patient at some point in time would kind of come back around, and that they would still then begin to continue to struggle again with seemingly more of the same issues. And as I began to look at that, I began to be frustrated kind of with my treatment patterns and frustrated with general counseling. And that was kind of where the idea and thought of there's got to be something else that could help the patient. And for me, as a Michigan State College of Human Medicine grad, I was trained in the biopsychosocial model. And in that biopsychosocial model, I was trained to also acknowledge that we are physical beings, that we are emotional beings, but we're also spiritual beings. And all three of those things make up who we are, no matter what our belief systems are. And it was under that premise that I started to explore what else was I missing. And from that time, as Gail, you and I know, we were actually in a Bible study with physicians at the hospital, and I began to share this with you as to my frustration in trying to really truly help patients get beyond maybe where they were at. They were kind of stuck, and I was stuck as a clinician, and really was looking for something else. And it was at that time, after that study, that yourself and doing health and healing ministry within the churches that you had helped out with, that it rolled off your tongue as easy as it was always there, saying that we really needed a spiritual care consultant. Now, as a physician and as a primary care physician, I use lots of consultants all the time for things that I don't have expertise in. And so that idea that Gail had suggested very much intrigued me. And so then we began to explore that in a further way in starting to put together spiritual care consultants.
Well, that leads me to ask another question, because, you know, when you deal with foundations and physicians, they want to know one particular question. Okay, so you're having spiritual care in the practice that helps people. Does it help for a week? Does it help for 2 weeks? What kind of lasting results have you seen? What kind of an impact have you seen with your patients that's been a lasting impact?
Well, for myself, it's been really eye-opening to see when patients begin to embrace this opportunity. And I guess what I would like to share briefly is how does a doctor do this? Because I think for physicians, before we answer that question, for physicians, this is, for some people, very uncomfortable. For many people, they are founded in a certain faith, and in this country, a lot of times we separate faith and religion, sometimes from business and practice, and Certainly in healthcare, there's a little bit more of an acceptance, in the case of cancer or life-threatening illness or acute situations that happen in the hospital, that we've always used clergy, and that's an accepted practice, but it's not been an accepted practice necessarily when there's not one of those situations available or happening. And so this is a little bit awkward for people, and I would be here to acknowledge that. For myself, it's probably less awkward because that's kind of what I've believed. Mm-hmm. And so what I would say to people is that just like you would use a specialist like a cardiologist as a primary care doctor, it's important to know and understand that the specialist as a spiritual care is much in the same way. You're identifying things with your patient that they're not getting better. And for me, what this was a recognition of things and what we would call spiritual things. Those are things that we would label as unforgiveness, or people have issues with shame or guilt, or rebellion, or anger. These are things that patients demonstrate a lot of problems with, or sleep issues. These are things that don't necessarily respond to pills. And these are things that people really need help in healing from. And I think our medical profession has really not done a very good job at really understanding how to do that. And certainly, as I indicated earlier, that I was frustrated with that. And so I think that's what this organization has done, is that it's allowed physicians to be able to have support in a way that we've never had before. So what we would otherwise think is difficult patients or people that weren't getting better, and oh my goodness, I'm going to have to spend 20, 30 minutes in the room and we're not going to get anywhere because of these issues. Now we have an opportunity to readily recognize those and give this opportunity over to the patient. And kind of how does that go? It's just a simple question about how are you doing? If this isn't working out for you, I have an opportunity for you to meet with someone that might help you in areas. Again, this is never forced. It's always the patient's will. Of course, it helps because it is a free service. And that's really, I think, an outstanding thing. Our community has supported our organization as well as other communities have supported. And what this is an opportunity for the patient to tell their story. This is not about making a patient into a certain denomination or faith. This is truly about healing. And I would say is that when Jesus Christ, if you believe that He was here on this earth, and you believe that the Bible is true, is that when He came here, He didn't ask the people that He healed what faith or denomination they were. He just went out and healed people. And that's what this is really about. This is about healing people from the things that are in their heart that lead to things that actually transform their body into a place that they don't want to be. And so what people do is then they substitute all these other things, drugs, alcohol, all these other things. They overwork. They go into areas in their life that they don't want to. They can't sleep, and they don't know the reasons why. Is because they're dealing with these issues, and this is the opportunity that we have to help to uncover these issues in a way that I think doctors traditionally never looked at.
And I would dare to venture a guess that you would invite other physicians to explore this avenue for their patients because of the good. Now, we've been doing this in the practice for 3 years, and you've seen a lot of good results from that.
I've seen excellent results, Gail, and this is not a panacea, but I would say in terms of all the things that I've been involved with in medicine, that this is one of the most rewarding things that I have been a part of, not just for me personally, but certainly for my patients, and to be able to help someone who seemingly felt like there was no help to be had is a pretty powerful and awesome thing. And certainly, Gail, as you and I both know, it's not about us.
Nope.
It's really about our patients, and it's about the healing that they're seeking out. And to me, that's just been outstanding. And really, again, this is an opportunity for patients to get better. And as far as my results as a clinician is, I've probably referred most of, or many of the patients, I would say, to spiritual care because of my understanding and comfort with it. But to be able to appreciate the patients, their comments about just to see the look on their face and to know that they have changed from inside out. And yes, some of them have been able to discontinue their medicines or decrease their medications. They've been able to stop their counseling sessions with their outside counselors, and they've been able to reconnect to their faith if that's been important to them, and just be able to walk clean and free, which is just a very rewarding thing for me as a clinician and as a physician.
And you know, the other thing that we have seen is that a patient that visits the doctor's office every month all of a sudden goes down to maybe once or twice a year. Because the stress, the anxiety, the panic, all this stuff is beginning to leave. And so it's not about us, it's about Him, and it's about the patients we serve.